Hi, my name is Vincent Ragozine, and I'm a physical therapist with TuDor Physical Therapy. I'm here today to demonstrate trigger point dry needling of the lower back. Our patient Esther here has tightness in her lumbar paraspinals. These are the muscles which run directly adjacent to the lower back. What we're going to try to do today is to get pain relief by loosening or relaxing the muscles and normalizing their tone using dry needles. Dry needles are actually the same needles used in acupuncture. These needles, however, are used in a much different way in trigger point dry needling. What we will try to do is to apply the needle into the muscle tissue itself, causing a reaction of relaxation and normalization of tone. As we prepare to insert needles, I'll palpate along the musculature, and I'll find areas or trigger points which seem to be tighter than they ought to be. And oftentimes, when I press into that area, there's pain associated with it. Do you feel pain here? And do you have pain here? Okay. So now that I've assessed the back and I've determined that she's an appropriate patient for dry needling, we'll go ahead and actually insert the needles into the muscle tissue. A little bit of a pinch. Again. So that was a twitch response. So her muscle actually contracted. It was an involuntary contraction. And oftentimes with dry needling, we will receive the twitch response. And that's a good thing. Usually when we have that, we've not only hit the direct area of the muscle that we were aiming for, but oftentimes there's a good result or a positive result afterward where the patient notices feeling much better. So as you'll see, I'm just placing these needles on either side of the spine in the tight and tender areas that she had responded to earlier. And done. So now that I've placed the needles, essentially the dry needling portion of this has completed. However, there's another technique that we really like to combine. And what we do is we take an electric stim unit and we attach it to the needles themselves. And what we're able to get is a more beneficial effect in that we're able to run the stim through the needles and through the muscle tissue itself, causing further pain relief. And also, actually, we're able to activate the muscle tissue temporarily through the stim unit and actually get it to contract. And what we hope is to get almost like a reset on the tone of that muscle. By temporarily hijacking the neuromuscular system, we're able to improve the overall activity of the muscle. So when she goes to activate that muscle under her own power, it'll behave more appropriately and more synchronistically. So here are the electric stim leads. And what I'll do is I'll attach these to the needles themselves. And we'll run current through the needles. And we'll attempt to activate the muscle tissue by stimulating the peripheral nervous system. Okay. So you're going to feel just a tingling, almost like a pulsing feeling. I'll let you know when I turn it on, okay? And you let me know when you start to feel it getting stronger. This should feel comfortable, not painful, okay? All right, here we go. I'm going to show you the unit here. It's just a simple 4-lead electric stim unit. What this has is the ability to run an electrical signal through the muscle tissue via the needle. Okay, I'm going to turn up a little bit higher here. You feel maybe like a little bit of pulsing there in your lower back. Feel good there. Now, I don't know if you at home can see, but we're actually stimulating muscle contraction here in the lumbar paraspinals. You can see that the needles are kind of bobbing a little bit. So once we've achieved this, we know that we're not only helping with pain relief, but we're going to actually stimulate the muscle tissue, which is really important for the neuromuscular re-education of the tissue we're treating. So once we've achieved this and the patient's comfortable, we'll let this take place for 5 to 10, maybe even 15 minutes, just depending on patient's tolerance and preference. And then once that time has elapsed, we consider that to be a good treatment, and we will then remove the needles and remove the electric stimulation. So we'll pretend that we've completed the treatment, and I'm going to go ahead and unhook you now, okay? Okay, so I'm going to turn the machine down and remove the alligator clips from the needle. And then I'll remove the needles themselves. So these needles are single use. They're used one time and they are discarded in a sharps container. We do not reuse them. Following removal of the needle, just take a little bit of alcohol and brush over the skin where the treatment was. And that would complete this technique. Most likely, you'll want to follow up with a nice warm pack after receiving this type of treatment. Not everybody likes heat, and that's okay, but I highly recommend it. That's about it. So if you enjoyed this or if you thought it was educational, please subscribe to our channel. And this is Vince from TuDor Physical Therapy signing out. Thank you.